Hello, my name is Lavinia K. Hunter, and I'm going to present Operation Narcotic Prescription Reduction. The purpose. The specific aim of this quality improvement project is the implementation of required utilization of a prescription drug monitoring program. Providers will develop more insight and awareness when it comes to the utilization and understanding of current guidelines for opioid use when prescribing. Evidence has shown that the implementation and utilization of a PDMP can effectively improve clinical decision-making when it comes to opioid prescribing, which helps to improve the diversion of controlled substances, which will ultimately result in less opioids being available to be abused. With the utilization of PDMP, less prescription opioids will be prescribed compared to the non-utilization of a PDMP. This will result in a decrease in the number of opioids available on the street that can be abused, with an ultimate outcome of fewer people dying of opioid-related deaths. The mission and vision of this intervention is to preserve life by the reduction of opioid prescribing. This is parallel to the mission and vision of improving community health and wellness of Northwestern medicine, where the intervention will be implemented. The short-term goal of this intervention would be educating providers on appropriate as well as inappropriate pain management, as well as providing access to the PDMP via the EMR prior to prescribing narcotics to allow prescribers to review appropriateness of narcotic prescribing. Long-term, this will result in less excess opioids-related adverse events such as overdose and deaths. All this will be accomplished by avoiding the most likely unintended risk of undermanaging patients who require genuine pain management. The PDMP is a statewide database that keeps track of individual patient quantities of narcotics that were prescribed. The prescribing provider, the pharmacy that the medication was dispensed, accompanied by the date of transactions. This information helps providers quickly identify signs of abuse, such as overlaps in prescriptions as well as excessive prescribing patterns. The opioid epidemic currently gripping the nation represents the deadliest drug crisis in the United States history. The opioid crisis was named as a national public health issue by President Trump in October of 2018. Currently, it is estimated that 11.4 million people misuse prescription opioids in the United States. Over 130 people die each day in the U.S. from opioid-related drug overdoses. In fact, the number of prescription opioid overdoses have more than tripled since 1999. In 2016, Illinois saw an 82% increase in the number of narcotic-related deaths, with an average of 14.7 deaths per 100,000 people in the state. Astonishingly, Cook County, which is where Northwestern medicine is located, saw a majority of the state's opioid deaths as compared to the rest of Illinois counties. Because of this epidemic, it is estimated that the U.S. is spending $78.5 billion annually to address the opioid misuse. Majority of all opioid deaths are directly related to prescription opioids. According to the Illinois Department of Public Health, in 2016, opioid-related overdoses claimed the lives of 1,946 Illinoisans. This is more than 1/2 times the number of homicides and almost double the number of fatal car accidents in Illinois. It is believed that the high prevalence of prescription opioid abuse is related to the ease of access to these prescription medications. Majority of those who abuse opioids took medications that were not originally prescribed for them, but obtained from friends and family. In 2012, there were more opioid prescriptions written, which was 259 million, than the number of adults living in the U.S. Practice recommendations. Although PDMPs have been implemented in 49 out of 50 states, each state has different regulations governing the utilization of the PDMPs. Majorities of the states do not mandate the use of PDMPs, although its level of efficacy widely is understood. As a result, many providers do not routinely utilize this invaluable clinical tool. I propose, if the utilization of the PDMP is required prior to prescribing of narcotics, there will be an overall decrease in the number of opioids prescribed over a 3-month time frame. This will result in a decrease in the excess number of narcotics available on the street for misuse. One of the missions of Northwestern is to improve the health of the community through leading innovative medical practices. The utilization of a PDMP allows Northwestern to fulfill its mission of preserving community health and wellness by decreasing the amount of excessive narcotics that are in the community that could be abused. Human rights will be protected by finding alternative measures to address the patient's pain management needs. All this will be completed within the hospital/clinical setting by providers only who have completed annual training on ways to ensure the safety of patient health information. All patient-specific interventions will be accomplished within the electronic medical record that is designed to protect the patient health data. The outcomes. The intended outcomes will be the following. The PDMP will be downloaded and embedded into the EMR. Providers will be well educated on appropriate pain management strategies and how to recognize likely abuse. Providers will have access to PDMP, which will be built into the EMR and required to be accessed in order to prescribe narcotics. Providers will make a more judicious approach when prescribing narcotics, thus decreasing the amount of excessive narcotics in the community, lowering the incidence of narcotic-related events. The action plan consists of the IT will evaluate server capabilities to accommodate increase in use, evaluate each clinical computer for adequate memory and speed. The PDMP will be downloaded to all computers and PDMP website access incorporated into the EMR, and providers will get full access to the PDMP. Management will provide education on dispensing and management of opioid-addicted patients. They will do a retrospective review of average opioids prescribed and a retrospective review of average opioids-related adverse events. Providers will attend education sessions on proper pain management and medication dispensing. They will make sure they have clarified any concerns regarding new procedures with pain management. They will utilize the PDMP prior to prescribing and overall reduce their opioid prescribing practices, current opioid prescribing practices. Patient outcomes will include a reduction in the excess opioids in the community and a reduction in the opioid-related overdoses and/or deaths. Evaluation. A baseline EMR review will be conducted by management. Data from the last 3 previous months will be collected to identify average rates of narcotic prescribing, as well as identify the average number of patients within the Northwestern Medicine facility that has presented with adverse outcomes related to opioid abuse, whether it be overdose or death. This data will be used as a baseline comparison to evaluate the significance of the data obtained after implementation of this quality improvement. The new data will be assessed every 3 months for a year to evaluate its clinical significance. This data, too, will be obtained by management by running a query within the EMR. When interventional numbers are below baseline averages, it can be determined planned change was implemented as intended and improvement in clinical practice has been achieved. Measuring the central tendency by calculation of the mean, the statistical tool to be used will either be a paired t-score, a chi-square test, or ANCOVA. I will identify if the reliability of the interventional change is significant based on the p-value. By comparing my interventional data with the baseline data, if the interventional data is noted to be different than the null hypothesis, then I will know for certain my interventional results were significant. I will set a baseline threshold with a confidence level of 95%. I will know if my p-value meets the threshold level by comparing the p-values with the confidence levels. Here is the current timeline. and references. This concludes my presentation. Thank you for listening. My contact information is here on the last slide. Thank you.